Welcome, ladies and gentlemen, to Doctor's Talk podcast series at MedSynapse. I'm Dr. Nigar and the Community Engagement Manager at MedSynapse. And today, I'm thrilled to have another interesting episode with our special guest, Dr. Amiryousef Zahedi. He's a highly accomplished family physician with extensive experience in family medicine and medication safety. As a fellow doctor, it's great to have you here with us, Dr. Zahedi.
Thank you so much, Dr. Nigar, and thank you to MedSynapse team for having me back for the second interview. And I would like to say that it's an honor and pleasure to be once again here. And I'm truly actually grateful for the positive feedback and warm reception from our last discussion. And today I'm ready to dive in and to share more about the strategies in managing multiple sclerosis.
Thank you so much for joining us today and for dedicating your time to this important topic. And in this episode of Doctor's Talk, we will be exploring the topic of multiple sclerosis. So let's get started. Dr. Zahedi, what are the early signs of multiple sclerosis that we as doctors should be aware of, and how is it diagnosed?
Sure, that's a great question actually. As a medical doctor, discussing multiple sclerosis today with you, I would like to explain that early signs and symptoms of MS or multiple sclerosis can vary from person to person. However, there are common early signs that patients may experience. So today I'm going to list some of them according to my experience and according to my research. So I would go just by order to what I have in my mind. So the first one, which is very important, will be vision problems. So the patients might experience blurred vision and double vision even, or eye pain can occur also because of optic nerve inflammation, and which we call it as optic neuritis. So it is common early symptoms of MS. But the second one, mostly patients actually experience fatigue. So, this type of fatigue is actually kind of different because it's unexplained fatigue and it happens due to lack of energy, and the patient feels like de-energized, which is common in most of MS patients. Even after having adequate rest, still the patient feels like they need some sort of rest. And the third one, to my idea, according to my experience, which is the most important one to diagnose it, because the patient might feel like numbness and tingling. So the patient will tell you doctor, I feel like there are some insects going on my body. So patient may experience sensation of numbness or tingling, and typically they feel it in arms, legs, face and feet, and it can also occur in other parts of the body. The fourth one I would like to mention is muscle weakness. So it is like weakness in the arms or legs, and also it is affecting the coordination and balance. So when the patient comes to your office, when you ask them to just go and to just follow a line, they might have problems in coordination and balance of their body. So other one might be dizziness and vertigo in most of the patients. They might feel lightheaded and dizzy, or experiencing kind of spinning and sensation and kind of vertigo. And it can be also one of early symptoms. Other one will be bowel and also bladder problems. So in MS patients, it can affect nerve signals. That also it can affect, and also in most of in nerve signals of a bowel and bladder system. So it is leading to issues like urinary urgency or frequency, and also constipation in some patients. Also, another symptoms can be cognitive changes. So in some individuals, they may experience problems with memory, concentration, and other like cognitive functions. Other symptoms I can mention is like emotional changes. So in MS patients, it can impact like mood, leading to mood swings, also depression and anxiety. And lastly, I would like to mention pain. So in MS patients, mostly like it is kind of MS related pain. We call it as MS related pain. So it is such as like nerve pain or like muscle spasm, which can also this one can occur in early stages of the MS disease. But these are actually most common symptoms based on my knowledge and experience. And regarding like diagnosis of multiple sclerosis, I would say that it involves like a combination of clinical evaluations and medical history review, which is very important, neurological examination, which is like it should be in our first line treatment and like to diagnose it, and also a specific diagnostic tests that we can use. Also, there are some key steps in diagnostic process, which include medical history. So in medical history, the doctor will ask about the patient's symptoms and their duration and any medical issues that might be relevant. Another one will be neurological examination. As I mentioned, it is very important. So the doctor will assess the patient's reflexes, coordination, and also strength, sensation, and other neurological functions. We have to check for all. The other one, which is very important, I call it as like friendly diagnostic tool, which is MRI. So this imaging technique is actually crucial in detecting MS. So it is, while after like getting result of MRI, you might see some white lesions on MRI, on mostly in spinal cord and brain stem cells, and like other diagnostical test might be lumbar puncture, which this test actually involves taking a sample of cerebrospinal fluid to look for signs of inflammation, to check if there is any inflammations or antibodies which are linked to MS. And also there are like evoked potentials. So what actually they measure the brain's electrical activity in response to sensory stimuli, and also can help detect abnormalities which are caused by multiple sclerosis disease. There is also blood tests, but this one is not actually like not that much essential, but this may be performed to rule out other conditions that can mimic kind of MS symptoms. But I might say that diagnosis of multiple sclerosis can be complex actually, and sometimes further evaluations or follow-up visits may be necessary to confirm diagnosis. And the early diagnosis are very important and essential actually for timely management and treatment to minimize the impact of disease.
Thank you for shedding light on the early signs of multiple sclerosis and the diagnosis process. As doctors, we need to be like detectives, spotting those clues and getting our patients the right help as soon as possible.
Absolutely right.
All right, let's break it down further for our audience. Can you explain the types of multiple sclerosis and their progression patterns?
Yeah, certainly. Actually, multiple sclerosis, it can be classified into several types based on its progression pattern, but there are four main types of MS. So the first one and the most common one is relapsing remitting multiple sclerosis. Briefly, we can call it as RRMS. So it is the most common form of MS, which is affecting approximately 85% of people diagnosed with MS. So people with relapsing remitting MS, they experience periods of symptoms getting worse and then even getting better. So between relapses, they may have stable periods with little or in some cases even no disease progression. So this one was the most common one, and but there is also second type, the secondary progressive multiple sclerosis. We call it as also SPMS, and secondary progressive multiple sclerosis. It follows a progression from the initial relapsing remitting stage. So in this space, there is actually gradual worsening of neurological functions over time. So it might be with or without occasional relapses in this type. So there are actually fewer relapses than in like the first type, and the disability also accumulates more steadily in this type. There is also the third type. We call it as primary progressive multiple sclerosis. This one is less common than like first and second types. So it might be accounting about like 10% of all MS cases, like less than even 10%. But unlike the RRMS and PPMS, it does not have actually distinct relapses and remissions, but it affects some people from the start. And we can mention that this form of MS may develop after years of having the first type, which I just mentioned that, relapsing remitting multiple sclerosis. There is also the fourth type. This one is not that much common, and it's like rare, less than 5%. And it affects only a small percentage of people with MS, but it involves both a steady worsening of the symptoms and also occasional relapses without full recovery. But definitely we have to remember that MS can be different in each person and each individual, and its course can be different in each patient. However, we can say that the early diagnosis and appropriate treatments are very important for all types of multiple sclerosis. It's like kind of key point for it.
Dr. Zahedi, could you enlighten us on the current treatment options for multiple sclerosis? Our audience of doctors is eager to hear about the latest advancements.
Yes, sure. That's very great question, actually. The current treatment options for multiple sclerosis includes let's call it like superhero team strategies. So disease-modifying therapies such as teclifidera and also copaxone, and we nowadays we use them mostly. They are actually the primary weapons against multiple sclerosis, and they are designed to slow down disease progression and reduce the frequency of the relapses. And they come in various forms such as injectables, oral medications, and infusions. So it helps us to give patients options that suit their preferences. But of course, beside disease modifying therapies, there are medications like gabapentin, which all our audiences might know. It is to manage specific symptoms of multiple sclerosis, such as pain, and it's very great medication to kind of control the pain. And also there is baclofen for muscle spasm, and physical therapies are also very important, and exercises like let's call it super yoga and even dance avengers are very important to strengthen the body's defenses. And it's like helping patients improve the balance, mobility, and overall the function.
Well said, Dr. Zahedi. It's like assembling a team of medical champions to tackle the multiple sclerosis from all angles. As doctors, we're always on the lookout for new advancements to enhance our patients' well-being.
Exactly, that's so true.
Now let's move on to the impact of multiple sclerosis on the nervous system and on overall health. Dr. Zahedi, enlighten us on how multiple sclerosis affects our patients.
Sure. Let's imagine multiple sclerosis is like as an evil or villain that targets the central nervous system. So I always describe it to my patients like this. Uh, you know, uh, it's like evil or like foreign body targeting our central nervous system, consisting the brain and also spinal cord. So imagine the nervous like we can imagine as like imagine the nerves as information superhighways which guiding message between different parts of the body. So normally these nerves are protected by myelin which act as cover. So now in MS, the MS system mistakenly actually identifies the myelin or what we just called cover as a foreign body. So and also it launches and attacks like nerve system. So what it causes, like it causes inflammation and damage to nerve system. So as a result, the nerve signals get disrupted and just like the traffic jams on the superhighways. So this can lead to variety of symptoms, including difficulty in walking, vision problems, even muscle weakness, numbness, or tingling, even emotional changes like mood swings. But I just describe it to my patients that there is like nothing to be worried because with the right treatment and support, we can just tame the problem and help patients to just get rid of this problem.
Multiple sclerosis is like a tornado, affecting the nervous system and overall health in various ways. It's like throwing a ball at our patients' bodies, leading to motor, sensory, and cognitive challenges.
Exactly. That's also another like great example. I would use it to explain it to my patients.
Now let's talk about lifestyle changes. Dr. Zahedi, what can our fellow doctors recommend to help manage multiple sclerosis through lifestyle adjustments?
Making lifestyle changes is like providing our body with a superhero support system to fight against multiple sclerosis. So regular exercises like super Zumba, Aqua Avengers, even yoga warriors, they have numerous benefits for multiple sclerosis patients. So it can improve the balance and flexibility and making everyday tasks easier to handle for patients. So, adapting a well balanced diet filled with fruits, vegetables, and whole grains, and also healthy fats is like fueling our car with like right and proper fuel. So maintaining a healthy weight is also very important, and to avoid excessive sugar and it should be processed food which can help reduce the inflammation and improve the overall health. But our also like a very key point and our friendly sidekick, let's call, is vitamin D. It plays a very vital role in managing multiple sclerosis. So getting enough sunlight and also taking supplements are very important, especially if the patients have a deficiency of vitamin D. Mostly we can say it in like Asian countries and like females, they have deficiency of vitamin D. So it can be prescribed as injection or even supplements. But lastly, and also like my personal opinion, actually most importantly, managing stress and getting adequate rest are like it's like our secret weapons against MS. So stress reduction techniques are very important, like mindfulness also and meditation. Also, it can be like as I mentioned, yoga. So they are like very helpful for stress control and to kind of handle our emotional actions.
I absolutely agree with you, Dr. Zahedi. Thank you for your wonderful tips. As doctors, we're not just treating the symptoms, but we're also empowering our patients to take an active role in their well-being.
Absolutely true.
Now let's shift the gears to the future. Dr. Zahedi, Are there any exciting new therapies on the horizon for multiple sclerosis?
Yeah, actually, absolutely. There are. Even right before our interview, I just went through some research. So we know that our researchers are like heroes working tirelessly to find new weapons against multiple sclerosis every day. But there are some promising like therapies, including like disease modifying treatments with improved actually effectiveness and safety profiles. So like one of them is ocrelizumab, which is like a very important drug for controlling and for managing multiple sclerosis. So these drugs actually stick to B cells, and if they are actually over controlled and like it's like already harmful, so they kill them to just and also it's supposed to stop and reduce the inflammation. Another one will be Maven clan, which is like generic name is actually cladribine. That one is also having the same structure. So we know that research is also exploring ways to repair damaged myelin, like it's like meeting back the race to for fight. So stem cells therapies and also therapies like hematopoietic stem cells transplantations are very important, and they are being actually under investigation nowadays. So we might have hope for future to be even improved. So I can say that our facilities against multiple sclerosis grows stronger and giving hope to patients day by day by better treatment outcomes and improved quality of life.
Thank you so much, Dr. Zahedi, for giving us an insightful and exciting news on the new therapies, on the new emerging therapies that may be available soon. Now, there's a saying, teamwork makes the dream work. Collaborating with other specialists is like forming a superhero team to tackle MS from all angles. Collaboration and support play a crucial role in patient care. Dr. Zahedi, how do you work with other specialists to provide comprehensive care for MS patients?
You hit a great point actually. Collaboration with other specialties are like forming a powerful team. So by combining our expertise, we create the best care plan for our patients. There are four types of doctors playing very important role together for treatment of multiple sclerosis patients. I call them as like in first line. We as family physicians, we act like first aid physicians. There are like neurologists. I call them as Dr. Brainstorm, and they are actually multiple sclerosis experts. So they are guiding the overall treatment and strategy for multiple sclerosis patients. Also, physical therapists, and they play also a very important role, as I call also them as like Captain Mobility, and they help patients improve mobility and function like professional fitness trainer for patients. And psychologists also they play very important role, and they provide emotional support like by helping patients to cope with the challenges of uh, this bad disease actually. By working together, I believe that our team ensures that each patient receives like comprehensive and also like the best care to optimize their well-being. And we make sure about diagnosing and treatment process so it increases the risk factors in patients.
As doctors, encountering patients with multiple sclerosis may vary, and it's essential to be prepared. Dr. Zahedi, do you have any advice for our fellow doctors who may encounter patients with multiple sclerosis? Like each patient's experience is unique, and being there for them is the best thing we can do.
Sure. Based on my experience, I would just have three important tips. Empathy and also patience are like our superhero tools as doctors. So for every patient's journey with multiple sclerosis, we know that like every patient has its own unique journey. So it is crucial to be like active listener and understanding their concerns and also fears. So we have to listen carefully to our patients. This is like very important and like first tip that I use it a lot. And that secondly, I would say that the empower like with the patients and with the knowledge about their condition and also treatment options. So we have to make them feel like they have been in our control for their disease. So to just reassure them that they are not alone in the fights, and together we as doctors are next to the patients like team. We are like fighting together against this disease. And lastly, I would say that emotional support, which is just an important uh, factor for our patient. So that's why in the beginning I just mentioned that being a good listener is so important for our multiple sclerosis patients.
Lastly, let's discuss the long-term effects of multiple sclerosis. Dr. Zahedi, what can our fellow doctors expect when considering the long-term impact of multiple sclerosis?
That's also a great question. So, the long-term effects of multiple sclerosis can vary widely from patient to patient. So, in some patients, they may experience a gradually increasing level of disability. It might happen over time, and in other patients, it will be just stable disease progression. But there are some potential long-term effects which include difficulty in walking, increasing muscle weakness, and challenges with coordination and balance. Also, they might have like visual problems and fatigue, and emotional changes also may be another worsening symptoms maybe. So, but however, with some treatment methods such as some medications and which I just mentioned, such as Tecfidera, it makes immune system to be less inflamed, and it aims to minimize the impact of MS, and it helps them to maintain their independence and quality of life to the best possible extent. So these are actually like some tips which might be like patients might experience for as long-term effects.
Dr. Zahedi, you have been an absolute rock star in this conversation. Thank you for this amazing conversation today on multiple sclerosis.
Thank you to MedSynapse team. It was another honor for me, and it was my pleasure to be here today again. Thank you so much.
We're very grateful to you for your time and for sharing your expertise and insights with us today. Thank you.
Thank you.
And before we wrap up, I would like to remind all of you about our MedSynapse platform, where you as a professional can actively participate in discussions and connect with experts if you're looking for a community where you can engage in meaningful conversations about medicine and contribute to the advancement of healthcare. Thank you so much for tuning in today. Until next time, take care. Goodbye.